Good evening, and welcome to the AANA Town Hall on Diversity, Equity, and Inclusion Awareness within the AANA. I'm Kate Jansky, AANA President. On behalf of myself and the AANA Board of Directors, I'd like to thank you for joining us tonight for this important conversation. This is an opportunity for all of us to learn, an opportunity to educate and convert. Over the past several months, our country has experienced unprecedented times and events. Each of us has been directly or indirectly affected by a pandemic. We are learning about racial inequality in healthcare. We're witnessing our nation's response to perceived racial inequalities, both peaceful and violent. In response to these events, we see an opportunity to bring together our membership to voice their concerns and seek solutions within the purview of our professional association. Thank you to all of you members who submitted questions in advance. These will guide our discussion with a diverse panel of speakers. We encourage a thoughtful discussion where members can express themselves in a non-punitive yet supportive platform. We acknowledge the discussion of racial issues within our professional community is sensitive. However, we believe now is the time to hear from our most treasured asset, our members. I myself have learned a tremendous amount in interaction with members and in reading over the past several months. Enough to realize this is an extremely complex issue without simple answers. While we recognize differences in opinions, we simultaneously respect everyone's contribution to the discussion. I will now turn this over to Dr. Moore, AANA CEO, who will give us an overview of tonight's discussion.
Thank you, Kate. It is a real pleasure and honor to be joining all of you tonight. Clearly, we're all experiencing the most transformational period in the history of modern healthcare. And you add to that what's happening with a global pandemic, what's happening in terms of the impact that and other things are having to the economy and social unrest. There is, when the history books are going to be written, I think this chapter is going to be right there next to World War II in terms of the most transformational period in the history of this country. So I know that we're all feeling a lot of that, and there's so much uncertainty, there's some fear, there's some doubt, and I really like to view these kinds of situations through a glass half full lens, meaning that, yes, we're in the midst of 3, maybe 4 different crises at the same time, but also think about the major opportunity that presents our members in this organization to start having some real conversations about topics like this. So increasingly, organizations like the AANA are having these conversations, and sometimes they're difficult. I say frequently they're difficult, and because they haven't really been conducted in the way that they should have, and it's been a long time coming. So I've been particularly excited about this conversation because of that. Tonight, I encourage everyone to approach this conversation the way that I am. I'm really here to listen, to truly listen, to learn, and to grow as a leader within the organization. Because I do believe that now more than ever, this organization needs to evolve. So as for our current and future leaders, we must embrace the fact that intellectual and demographic diversity makes us stronger, makes us a better organization. So with that, I look forward to the conversation we're going to have.
Hi, I am Monica Rose, and I am the current chair of the AANA Diversity and Inclusion Committee. And I have served, this is my second term serving as chair. And I believe that the information that we discussed tonight is key to our professional growth and to the growth of our committee and to the growth of our organization as a whole. So I would like to thank Randy Moore for his comments about expanding the knowledge, and we do hope that our discussion tonight will expand your educational and professional landscape as we move through these challenging times that have affected not only the AANA, but other professional organizations and educational organizations as well. So I'd like to welcome you to our first AANA Town Hall discussion on diversity, equity, and inclusion. I'd like to thank all of our panelists for agreeing to participate in this town hall discussion. We're looking forward to answering some of the challenging questions that have been submitted and starting the discussion, while at times may be a difficult discussion, is a discussion that we believe needs to take place. So tonight we have a very distinguished panel of guests and speakers. We have our president, Kate Jansky. We have Randy Moore, our CEO. We have Deborah Diaz, who is on the AANA Board of Directors. We have Sonia Moore, who's also a current AANA board member and Region 6 director. John Bing, a former AANA board member and Region 6 director, will be joining us. And certainly not least, we have Sally Maria Proposal, a former AANA board member and Region 4 director. So without further ado, perhaps we can move into our questions and start the discussion on this most important topic area. So to our panelists, are there any further comments before we start into our questions? Okay, so the first question, and again, these questions were submitted from our membership, our valued members whose voices certainly deserve and need to be heard on these most critical topics. Our first question reads as follows. How can we encourage AANA members who do not see the value in diversity and inclusion initiatives for the profession to reconsider their position? Thank you, President Jansky.
Hi, thank you, Monica. I'd love to answer that question. I've not heard members say that they're against diversity and inclusion. I have heard members say that they would like to see us all treated the same. So I think that's a good thing. Second, we're supporting diversity and inclusion within our current structure while continuing to focus our organization on the professional goals that benefit all CRNAs, such as full scope of practice, reimbursement, and academic excellence, so we're able to represent ourselves as experts in anesthesiology. Universities have spent billions of dollars implementing diversity and inclusion departments that, based on the comments from students, are not fixing the issue. While we want to respond, we do not have unlimited resources. President-elect Sertich has tasked the Diversity, Equity, and Inclusion Committee for next year with developing an overarching strategic plan for the program.
Thank you, President Jansky. Would any other of our panelists like to chime in and address the question, which I will repeat? How can we encourage AANA members who do not see the value in diversity and inclusion initiatives for the profession to reconsider their position?
I'd like to answer that question.
Thank you.
That's actually a loaded question. So allow me to unpack it a little bit. First, there's the question of why. So I'm curious what makes a person, or in this case, our members, not value diversity and inclusion. So but before anyone can encourage to value anything for that matter, one must really commit to learning the why. And that is not easy to do. So what I would offer to submit to you is to first consider a self-examination or a personal evaluation, a self-awareness, if you will, of what roles we play. Because what drives our behavior is how we identify ourselves within that role continuum. This is a part of a framework from a corporate training in diversity, and there are 5 roles that any one of us can assume. And you can identify yourself in any of these roles. And many of our members, all 54,000 of them, can. So number one role is the pioneer, the facilitator, if you will, one who creates and casts a vision for change. So when you hear a pioneer do a self-talk, you would hear him or her like this: this is wrong, and how can I make this right? What can I do to lead? That's one role. The other role is, number two, is a champion, which means you are a supporter for the vision and change for diversity. Third role is that you are an influencer. Now, you know that role quite well. You carry the message to the larger community of our CRNA community. So the question or the self-talk of an influencer is, how can I spread the word? How can I get others to join? Or how can I take this further? The fourth role that we can find ourselves in is the hesitator. You wait and see, and you watch from a distance, and your self-talk would sound like this. Is this safe for me? Let's wait and see. Don't stick your neck out. And the very last is an obstructor. Basically, you obstruct and are willing to change. So we can find ourselves in these roles, and you hear an obstructor commonly say, this won't work, here we go again, it's a waste of time and money, we don't have this problem. So to me, once you have identified yourself, who you are in the continuum, the next question then is, who do you want to be? By and large, people is right around the middle, the hesitator, influencer, a few in the obstructor. There's no problem with the champions and the pioneer, the influencers, but it's the hesitator and the obstructor. How many of our members are in that role? So that's the most important thing. If we have to encourage anyone to promote and support diversity, I would encourage every member of the CRNA community to self-identify who they are in that role continuum, which role they play, and then ask the question, who do I want to be?
Thank you very much for your very enlightening description of the different roles. I might just add, and this is not scientifically based, but this is Monica based on the roles that you so eloquently identified. I might also suggest the role of the denier, the person that doesn't believe that diversity, equity, and inclusion has an impact on our professional practice, an impact on our educational development of our students, and an impact on our organization as a whole. I do believe, even just from anecdotal conversations that I've had with individuals, that there remain individuals within our profession and outside of our profession that deny the need for diversity, equity, and inclusion. And in support of that need, one approach that we as professionals can do, or that we can take, is to provide the data, the examples, the statistics, and the outcomes that support the need for increasing diversity, equity, and inclusion initiatives. Does anyone else have any comments about our first question? Comments, follow-ups, or other statements?
I might add, Monica, that our goal perhaps is to move people from the denier to the obstructor to the hesitator. And how we do that is how we promote and support it. Take them from where they start, because the motivations are different. Like the denier has a different motivation, the obstructor has a different motivation, and so is the hesitator. If we can at least make a progress towards having them to be willing to move from an obstructor, from a denier to a hesitator, we've made some steps, a small step perhaps.
Thank you. Thank you for your salient points.
Yep.
And in order, I just might add that after identification of where you fit on that continuum, well, even before identification of where the individual may sit on that continuum, it's important to just have the conversation. And that's what we're doing with this town hall, is we're having the conversation about a challenging topic that has the potential to impact, or if it hasn't already impacted many members of our organization. So moving forward to our next question, what are the most powerful values to members of diversity and inclusion initiatives from the AANA? Let me read that again. I feel like I stumbled over it a little bit. What are the most powerful values to members of diversity and inclusion initiatives from the AANA? Who would like to make some comments about that question? Well, I'll start in brief. What are the most powerful values? Sometimes I think of values as being inherent and being very personal. But I think from a value perspective, a very high level value perspective, on any topic, whether it's diversity and inclusion, educational development, the practice committee, our students, I think most people appreciate being respected. And so I think the value of extending respect across members of our profession might be a good starting point to address that question. And I welcome others' input on that. I think you're muted, Maria.
Sorry. All right, I will add that I think we start with treating each person, one of the most important values, with human dignity. And it starts with words. If we start respecting and treating each person or each individual with human dignity, that will go a long way. And a lot of other times it starts with words. It only starts with words.
Thank you for your comments. Randy?
The other thing that I would throw out there, just processing that question, obviously it takes me longer than most to process. I think, just thinking about myself and the conversations and the experiences that I've had in my role is, I think curiosity, right? And I think I mentioned this in my opening remarks, is that I think we have to be willing to acknowledge there are things that we were not aware of or fully appreciated because of the way that we were raised and the environment that we were raised, and that my life experiences, even though I have CRNA after my name, may be very different than yours, even though you have CRNA after your name, right? And one of the things I've learned as I've matured and I've been exposed to this concept and hearing the life experiences of my colleagues who did not have the advantages that I had, is that I am much more open and curious about those life experiences in ways probably because I just hadn't have the exposure. I thought, well, obviously, everybody excels and you show up and you do your best. And one of the things that has been, and I know that sounds naive, but I think one of the things that's been really impactful to me as I'm learning and growing is bringing that sense of curiosity and to keep my mouth shut and listen as much as possible to people who have different backgrounds, who've had different experiences than myself.
Thank you, Randy.
That is really well put, Randy, because that reminds me of being above the line and being below the line. You mentioned about being curious. Being curious and being open and being committed to learning is what makes you working or functioning above the line, rather than being closed, judgmental, and committed to being right. So be open, be curious, and commit to learning.
Thank you, Maria. And Sonia, I see your hand.
Well, I agree with what everyone has said, and I I truly believe that that respect for each individual's own life experience is what's important. And I think Randy and Sally touched on that, where we have to be open to one another's experiences and acknowledging that our experiences are very different. And it doesn't make any one person's experience right or wrong. They're different. And then how do we bring that to the table to help our colleagues and each other feel included, welcomed, and valued? It's one thing to go from my whole experience and what I experienced and try to put that on someone else, assuming that that was their experience as well. And most often it's not. Even for similar diverse individuals, the experience is very different, but being willing to acknowledge it and saying that my colleague's experience is different. I'm going to own that our experiences are different and take the time to understand what their new experience in this profession and this role is like, because they're very different. We can see that. I think you started this off when you were talking about the committees and things like that. We can see that over the history of the organization, who's been on committees, who's in leadership, and where things are. And a lot of that comes from where we've been. And so if we're open to being respectful of our past experiences and bringing folks along to say, I understand that your experience was different. I want to learn from you and you can learn from me. Because one thing we all have in common in our profession is we know how to give anesthesia. Everybody knows how to do that part of it. But how do we do that human part? How do we do the people part? How do we recognize that, yes, we are equal beyond the anesthesia piece? And I think that that's very important.
Thank you, Sonia, and President Jansky and Deborah, thank you.
So at this point, the question I'm asking myself, I've seen a lot of comments about what happens to minority students in the schools, but I don't have an appreciation for what happens to a minority practitioner. What are these experiences you're talking about that I'm unfamiliar with that are making things difficult for you?
Deborah, do you mind if I just answer that and then I'll come right back to you and then to Sonia? Okay. So thank you for your question, President Jansky. As a Black woman practicing since 2001, I'll just give you an overview of what that's like. What that's like, or what it has been like for me, is that I can say the same thing as a Caucasian woman or an Indian woman, or let's just say a woman from another race. And it can be interpreted as aggressive, difficult to work with. She's overreacting, and I can use the same tone, I can use the same words with the same physician or with the same nurse. It doesn't even have to be a physician. We don't have to get into hierarchy, but it can be the same words, the same tone. But I have been labeled as being, well, she's difficult, or, oh, well, she's too aggressive. And so those are the types of things that, as a Black woman, that I have experienced. I've experienced microaggression. I've been in operating rooms where I'm the only Black person in the operating room. And, the circulator or the surgeon and the other paramedical personnel that are in the operating room, they're laughing and they're joking and they're listening to music. And if I chime into the conversation, the whole room gets quiet, or they may not answer. So it's hard to describe, but in certain situations, and I guess you just kind of have to be a person of color to understand this, but you kind of get talked down to a little bit. It's kind of like a subtle, demeaning, you know, how dare you say that to me type of response. And it's not new. And I've experienced it, and I laugh at it because I'm very confident in where I came from, where I am, and where I'm going. And I've learned over the years to address it professionally. Those are just a few examples, but I certainly want to hear from other members of this town hall. But to answer your question, it's a subtle kind of, it's a subtle, how dare you talk to me type response in some situations. And, oh, but let me say this before I go. Not go, but before I pass it on to Deborah. This is actually funny. So, so I have a earned PhD, which you all know. And I walked into a hospital about a year ago, and I walked through the double doors. That's kind of an anesthesia thing. You know, you have to go through the double doors to get in the OR. So anyway, I go through the double doors, and I walk into the anesthesia workroom, and one of the anesthesiologists, he looks at me and he says, well, you know, I think they spilled something down right beside OR 3. And so I'm getting a propofol pump, and I'm grabbing propofol tubing and what have you. And so then he leans over to me again and he says, they spilled something down by OR 3. So that is an example of, well, let's see, maybe microaggression, assumptions, but he automatically assumed that I was supposed to be the one of the people in the anesthesia workroom that was supposed to clean it up. So those are some of the experiences, some of the things that I have experienced, and there are thousands, hundreds of thousands of other examples. But anyway, Deborah, I'm gonna go on mute, and let's hear from you.
So the values that I look at that are near and dear to me are acceptance and tolerance. However, acceptance doesn't mean you accept unacceptable behavior. And I have witnessed unacceptable behavior to me often. And there's so many examples that I'm not even gonna, you know, articulate any in particular. One of the surprises to me is when someone looks at people of color and says, they're so articulate. And I'm like, why wouldn't we be? So now sometimes when I hear people on TV that are of color, I laugh because I think to myself, ooh, they're so articulate. You know, and it's just, it's laughable to me if it wasn't so sad. So those are just a couple of the things that I look at. You know, I've been asked when people don't hear an accent, even though English is a second language for me, and they don't hear an accent and they go down this road, well, where are you from? I'm from Miami. Yeah, but where are you from? Originally, well, I was born in New York. I know where they're going with this. I know they want to know what my background is, and my passive aggressiveness will make them work for it, you know, because basically they want to know what ethnic background I'm from. And you know, it's, I don't know, Kate, how often do you get asked, well, where are you from? What are you, yeah, but really, where are you from? You know, if you tell them I'm from Colorado, that's the end of it. They don't, I venture to say that they don't go any further.
Well,
You know.
actually they do. They'll say, well, no, where did you grow up? Because either I have an accent or not. But if I were to ask, what's your heritage? Is that an insult? Because I don't see that as an insult. So why is that, you know, you said, well, I make them work for it. I consider that a value in a person. And I'll ask people all the time where they're from, and I don't realize that I'm insulting them. So
the next question is, I thought you were white. That's usually the next question. So it goes from there to, but I thought you were white.
Just to keep the conversation, the town hall moving forward, it depends on the intent, President Jansky. And as a woman of color, you know, I've been a woman of color for a long time, and you can tell the difference. I can tell the difference if someone is asking me about my heritage because they're curious, or I can tell if they're asking me because they don't necessarily really want a person of color taking care of them, or they may not trust my skill set. So again, it's hard to describe, and I really hope other panelists will kind of jump in and help me articulate the words, but it's a subtle, microaggressive dig is not an intelligent word, but it's subtle. It's like kind of like a, oh. And I've walked into the pre-op holding area, and you know, they'll put my last name Rose on the board. So they'll say, well, Rose is going to take care of you. And then I show up and it's kind of like a, oh, hi. And it's not a, oh, hi, it's nice to meet you. It's a, oh, hi, I wasn't expecting you to be who you are. So Sonia, did you want to say something before we move on?
Like this whole idea of how, you know, as a diverse person, you're made to feel. And I think it goes, there's a spectrum, right? It goes from a macroaggression to a microaggression. And it can be as macro as being called the N-word. I've experienced that from colleagues, from patients, and having to deal with that to those very subtle things. And when I think of the microaggressions, I think of it as a marginalization of who I am and who my identity is that this person is saying to me, either by their language or their body language, that they don't accept me as an individual, as my identity. So when someone asks me for to clean up something, or for a pillow, or why aren't you doing this? Aren't you housekeeping? And it's even people that you know who you are and what you're there to do. It is trying to demean me as a human being, okay, in a very subtle way. So I think when we think about this, how are we made to feel as professionals, it's just a big spectrum, a wide range of ways that we are made to feel, to the most denigrated, you know, by being called out of our names or being said we don't belong there. I've been told that on several occasions, from when I was in school to being in the operating room saying I don't belong behind the drape. I've been told only smart people belong behind the drape. So what about me said to this individual that I wasn't a smart person? It's that they looked at me and made that decision. So I think it's just a wide spectrum of how someone identifies you. And it is very subtle, but it doesn't necessarily have to be. But let's be clear, all of it is designed to demean the individual and make them feel less of themselves and make them feel unwelcome and unwanted.
And thank you, Sonia, and everyone else, and President Jansky. I hope that provided you a couple of different perspectives, and certainly we can come back to that. I would like to, if you don't mind, to continue to move through some of our questions, certainly as time permits, and we want to welcome John Bing to the conversation. Hello, John. So our next question reads, is there an annual stratification of practicing CRNAs by race? If so, how is that data used or discussed?
So yes, when we fill out our surveys, we do get the opportunity to state what our ethnicity is, what our race is. For a long time, I would fill out when they would ask me under race if I was Hispanic or not. And I usually would fill out, that's an ethnicity, it's not a race. So we do have also, people have the opportunity under, the option, I'd rather not say. And right now we have minimal diversity in our membership as people will identify themselves. We have 0% of Native Americans, Indigenous peoples, Alaskan Native, Asian or Pacific Islander around 3%, Black or African American is 2%, and Latinx is 3% with 88% white or Caucasian identified, and other is 4%. Being of mixed race, I usually put other because we don't have a box to check for mixed races. So what we do with that information, to be honest, I don't know, except to identify.
Rose, let me pitch in here for a second, if you don't mind.
Certainly.
Yeah, and so the information that we get, first of all, is maybe 4,000 or 5,000 people will actually answer that question. So this information is really not relevant. It gives you a very, very small window of what you're trying to find out about race and ethnicity in our association. Now, I have talked to Dr. Jabasi about this, and I said, we need to track this. If we don't know who's coming in and who's getting out, or what the problems are, then we're not doing our due diligence. And med schools do it, dental schools do it. And I talked to him last week about it. I said, is it time now that we have to be able to measure that? If we don't, and stop kicking the can. Because, they blame the ANA, they blame NBCRNA, and it's right back to them. And we need to get into a room where everyone is in the room and make sure this is relevant. I said this. I say, if the 10% is not relevant or does not matter to you guys, let's just stop the conversation. But if it is, then we need to continue and find out, are these numbers relevant? If they're not relevant, then let's move on. And I think they are. I don't think that, I think the nurses and the ANA is big enough. And I think that we're professional enough to say that this is the issue that we want to deal with. And as I was talking, I've talked to Kate a few times this week about this, and these millennials are on this. Our generation may not think it's significant, but these millennials, they want to make sure that this association goes forward in a positive manner.
Thank you, John. President Jansky.
Yeah, I just want to say that I think we're talking about two different things here. We're talking about what is the racial makeup of our organization, and then what is the makeup of the students. And that's two different things. So I agree with you that we need to bring those people forward, but we can't bring them forward until they're there. So that's a different topic. And I totally support the idea of looking at at data and figuring out where we are and what we've got and how we can make it better.
Thank you. And I think that's a good segue into our next question. What scientific statistics do you have that support the premise that the CRNA community is not inclusive and diverse? So again, what scientific statistics do you have that support the premise that the CRNA community is not diverse and inclusive and diverse?
So I read off the statistics that we have based on the information. And so while you look at the demographic makeup of the United States and its territories, the percentages that I just read off does not reflect what the makeup of the United States, the demographics of the United States and the territories. So unfortunately, we are, as a minority community of all makeups, Pacific Islanders, Latinx, African American, mixed race, we do not reflect the demographics, as I said.
Thank you, Deborah. President Jansky?
I just wanted to go back to Deb. Thanks for that. And those numbers, what John brought up is that not everybody fills out that survey. So maybe what we do is we go back to either our membership renewal surveys or even to the NBCRNA and ask them to track those numbers. So we see what are we across the population of CRNAs to get some good data.
Thank you. Randy?
Yeah, I agree that the data is key here, and we should be intentional about acquiring meaningful data and then measuring it longitudinally. And I think that is really important. I'll also, give you a very unscientific observation, which is, if you look at the composition of the board of directors next year, there's not a lot of diversity there. And so I get that we're talking about data, and data is key, right? We really need to get our hands on meaningful data. We can also look at the senior leadership of the organization and say, wow, this is an organization that has diversity, equity, inclusion on its website. It is a value. It is in the strategic plan, but looking at the board next year, it doesn't look like they're engineering a process to promote demographic or intellectual diversity. So I think that's, yes, data, yes, but also we have to be really conscientious of how the composition of our senior leadership and what the message that tells members in terms of how we truly value the concepts of diversity, equity, and inclusion.
I completely agree. And Sonia, just one second. One thing I'm going to say about data is there's observational data, there's statistical data, there are qualitative studies, there are quantitative studies, and I do not know this for sure, but just having conversations with colleagues and people that I've known over the years, to answer what scientific statistics do you have, you may not necessarily have scientific statistics, but we do have providers that routinely attend state level and national meetings and do not see themselves represented as speakers or, again, as Randy said, on the board or holding higher level positions within the organization. So you're on mute.
So Monica, I was going to speak to some of what you just mentioned. I think it's about us being intentional about diversity. We can have the numbers, we can have the statistics, we can have the observations, but until we are intentional about having diversity in our leadership, in terms of the board, in terms of our executive C-suite area of the organization, if we're not going to be intentional about it, it's never going to happen. because we've already kind of talked about how minorities are made to feel within a profession. So then how are they built up then to become leaders in organizations, leaders in their workplace, leaders in the executive suite? I know a lot of people have been calling for a diversity officer. You know, and Randy and I have had this conversation multiple times, because I truly feel that you can have a diversity officer, and that's a symbolic position, if you will, unless it's very intentional and that person is at that C-suite level where they have access to all the operations within the organization to say, hey, this is where we need to implement programs and do things for folks, including CRNAs, our staff. I mean, because when we're talking about SRNAs, CRNAs, our staff, we don't have a very diverse staff at the AANA. So I think being very intentional about what we're observing helps us get to that place. But it then drives us back to that whole acknowledging that this is where we are. You know, and I hear our CEO saying, yes, this is where we are. So what are we going to do about it? And I think a lot of it is being very intentional about it, regardless of what the negative or impact or consequences may be. If we're going to be intentional, we're going to be intentional. And then we're going to deal with those consequences as they occur.
Thank you, Sonia. And I will just add intentional and transparent. So moving forward to our next question, what is the AANA doing to make the professional, the community we serve, and the students we teach?
So I'm just going to put it out there right now, how we stand, I would say not enough. But we're at a tipping point, an inflection point. And I think that I'm an optimistic person, and I think that we have an opportunity to go from not enough to we can kick this in gear. And as Sonia was talking about having a diversity officer, we've had members over the past couple of weeks give us a multitude of suggestions offered to help with the situation and put into action, because without action, you can talk from here till tomorrow and nothing is getting done. But put into action programs that we can see will move us in that direction. And I'm very hopeful that we are going to get there.
Thank you, Deborah. Would anyone else like to comment on that question?
Right now? Well, I'll say this, that, it should not have taken this long to do a self-evaluation. As I tell people all the time, this is one of the most segregated professions out here. Anytime you have 90 and 10, that's segregation. And so when you're too comfortable, you have no reason to change. And what happens is that over a period of time, we're doing fine, we don't need this. And I heard someone say that, we should just take our time because we're not ready for this. And listen, there's never a right time to do the right thing. And George Floyd, or this episode that we've had in America, should never have, we should be way out in front of this. And, Randy talks about this all the time. He talks about be strategic in everything that we do. And the key to this right here is that you have to buy into this. And I buy into it, but when I come out of the house every day, I know what I am and I know what I have to face. But if the majority doesn't feel this is an issue, then they're not. And so we shouldn't have to push this issue. You know what happened about 2 weeks ago, about a month ago, when everything came out about the George Floyd incident? And I had a bunch of my friends from the ANA call me up and they said, John, I had no idea this was going on. I said, how can we help? I said, listen, this is a white problem. We've been here for 400 years. We can't change it. The majority have to step up to the plate and say, listen, this is not right for anyone. And if they don't acknowledge it, if they don't have a self-evaluation, if they don't have a plan, then all we're doing is we're just kicking the can. This has been going on since I was born, 50s, 60s, 70s, 80s. And so we have to have leadership says this right here. Strong leaders will say, this may be unpleasant. This may not be what the majority wants, but this is right. Nothing different than Lyndon B. Johnson or JFK said the same thing. And we need to learn from that. We should not be going in the same circle we've been going on for the last 40 or 50 years.
Thank you, John. And, you know, in terms of what the profession can do, what the AANA is doing to make the profession look more like the community, I would like to hear or for us to think about as we move forward, program level initiatives, how the programs are responding to their applicant pool, their recruitment procedures. You know, how can the profession make itself reflect the community that it serves? So I think I cut you off, President Jansky. I apologize.
I was just going to add something to what John said, in that I think we have recognized this as an issue. We've had the Diversity and Inclusion Committee for several years. They've been working on different things. We are aware of the issues. So to say that we've just ignored the issue is not true. However, I think we have to be very careful about engineering an answer. I think when you fail to educate people, I think we have to concentrate on educating members, like the questions I ask. I'm not Black. I don't know what it's like to be Black. I've been told, hey, you know, don't talk to the doctor like that. You know, you're too forceful when you're running a code or when you're doing something. You know, you should be nicer when you do that. You're putting people off. So we all have some of that feedback, and I'm not saying mine's the same as yours, but we have to be careful about engineering an answer that is not based on educating our members first, or we're going to lose a lot of our members who, as John said, might not be ready for this. So we have to take this more slowly, and we have to, as Sally said, decide where we want to be on this continuum, but then educate members as to, yes, this is what's happening out there, and you may not be aware of it because it doesn't affect you, rather than saying, okay, tomorrow we're going to have this percentage and this percentage. And again, I think we're kind of confusing the education issue with the people that are already in the profession and working in the profession. And I think there's a couple different questions out there as far as the education goes. Thank you.
Thank you, President Jansky. Randy?
Well, I certainly agree that education and communication is what we're doing here tonight, right? And I think a lot more of this needs to occur, and it should have started a long time ago, but here we are, we're having the conversation. I think one of the challenges that this organization has, and many other membership organizations are in the same boat, and I was on a town hall this morning and for a similar topic, is that our governance model, our business model is predicated on trying to be all things to everyone, meaning that we got to go right down the middle. We don't want controversy, you know, and we want, you know, we don't want to disenfranchise anyone. So let's not take any risk. And I think that is a operating model or a business model that's going to become antiquated pretty quickly, and it's already starting to. And that members, particularly our younger members, want their organization to stand for something, right? They don't want a right down the middle. And I'm not talking about whether you're Republican or Democrat. That's not the conversation we're having. We're talking about these important issues that that society is grappling with. And I think organizations who are like, we're not a political organization, we're apolitical, that's not going to work. It's not going to work. Our younger members are going to demand this organization take a position and allocate resources accordingly. So I think we got to balance that transformation that needs to occur, and moving away from being all things to all people and acknowledging that, yes, let's educate. Let's bring let's bring as many of the resistors along. But there's going to be a point in time where we're going to have to leave some people on the side of the road. And that's a difficult decision, because look at our business model, which is predicating on maximizing as many members as possible. So it's a really important conversation, and I'm glad we're having it.
Thank you, Randy. Sonia?
So that's kind of what I was alluding to before when I was talking about the consequences. So at some point in time, we will have to make a decision whether or not this diversity issue or concern, conversation, if you will, as John Bing said, is important enough to us to do the right thing. And those people that Sally was mentioning, the hesitators, the obstructors, the deniers, that we're going to try to bring them along with us. But at some point, if we're going to become the dynamic organization that I think we all want, that we are going to have to say that this is what we want to do. This is where we're going. This is our strategy to get us there, and do it and deal with those pieces or those consequences as they come. And I think Randy is 100% correct. Every time we have an issue within this organization, our response is always predicated upon which side says they're going to give up their membership first, or how many memberships are we going to lose? And it becomes this battle of which is more important, the 10% or the 90%. And I think it's all important, but I think we have to concentrate on doing the right things for the right reasons. And I think that that's vitally important for us going further.
I just want to say something, Deborah, before you jump in. Membership, by my very limited knowledge, is cyclical. So as you have attrition with members, you have onboarding of new members. And so hopefully, as we move forward in what I'm going to say is the right direction, that those numbers of attrition, may not be quite as pronounced as maybe we may anticipate. But Deborah.
So I graduated over 20 years ago, and this has been an issue for decades, as John has said. And when are we going to take a stand? How slow do we have to go? We've been dealing with this for decades. I have a book right here, which is Nursing's Social Policy Statement. And I'm teaching a class role of the DNP. And one of the issues that I'm teaching my class is that nursing has been political since the days of Florence Nightingale. And she was considered a revolutionary for some of the policies that she brought about. And one of the problems that we've had is up until the 50s, nursing became apolitical. We didn't want to get involved. And that, I think, was a big mistake of not getting politically involved. And I'm not saying, again, as Randy said, Democrat versus Republican, I'm saying that we need to make statements of social justice. Nursing was involved with suffragettes, getting the women's vote. That was considered horrific. And we are in that same point, but a different topic or a different concept. So when do we say, there's a saying, if you don't stand for something, you're going to fall for everything. So I believe we need to stand for social injustice, because there's no question scientifically, we all say we want to practiced by the evidence. The evidence states that if we are not able to be culturally competent and reflect the demographics of the United States, our patients will suffer. I think that people that say that that isn't so is naive. The statistics and the evidence has shown that we need to reflect our demographics, because we cannot care for people unless we are culturally competent, unless we address our implicit bias. And some of our bias is not so implicit. Some of our bias is just out and out there. All you have to do is take a look at social media. That one CRNA on Facebook that talked about she was ready, that person was ready to start a war based on what's been going on in the streets and with the protesters. How many people did that offend? I can tell you it offended me, you know? And so I think we need to be able to say, okay, you know, we are ready to take a stand.
Deborah, thank you for your comments. I actually did not see her post. I heard about it. And at some point, I'm not going to say I become immune, but at some point I just say, well, you know, okay. I don't think her war is going to be any worse than the war that probably some of us have been fighting for a long time. So, President Jansky, I thought I saw your hand.
Yeah. I just wanted to add that I agree that we need to have a social competency with taking care of our patients. And that's our main issue, our main role. I disagree that we need to become a political organization, that we need to take on political aspects. The ANA does that, and their membership is very low. And you say, well, we're just worried about membership rates. We're also worried about what our members want. We're worried about what the majority of the members want to do. And I think the majority of the members are behind learning about this issue. We have the Diversity and Inclusion Committee. I don't think we've been ignoring this issue at all. And I don't think we've been skirting it or trying to get away from it. I do hear again another reference to the education of bringing people up the pipeline in order to have a larger component of our membership be minority members. So maybe we need to look at the education issue as well as within the organization at the diversity and inclusion issue.
Thank you, President Jansky. I would just like to say, from my perspective, whichever direction we decide to take with this, this being the broad spectrum topic of diversity, equity, and inclusion. I think we all need to be headed out. We all need to head in the same direction. And if for some reason, you know, if you're not on board with that, and if it's not, and I don't mean you, I'm just saying, I'm using that word arbitrarily, that you can support from a distance and not sabotage. So, you know, to our members that may not necessarily think that this is as important, I can certainly understand that, and I can respect that. That kind of goes back to one of the first things that I said, was that I think a large part of diversity, equity, and inclusion has to do with respect. But just because you don't necessarily support it 100% doesn't mean that any actions should be taken that egregiously go against it. So that's just my personal and professional opinion. So moving forward, if you don't mind, what are your thoughts on the suggestions for growth that were proposed on AANA Connect for AANA and COA to consider? Many suggestions have been provided. To highlight a few. And Sonia, I believe that this is your section, and that you'll be helping us to answer this question. And once again, I feel like I fumbled over it, so let me read it again. What are your thoughts on the suggestions for growth that were posed on AANA Connect for AANA and COA to consider? Many suggestions have been provided. To highlight a few. Sonia, do you have it? Do you have the document with you, or should I read through some of them?
You can read through some of them.
Okay, so in brief, mandate education for AANA executive leaders, board members, committee chairs, and AANA staff related to implicit bias, racism, bullying, and stereotyping.
So, in all honesty, I think that those two particular things are good for the organization as a whole, not just from a diversity perspective. I think that we need to have competency-based leadership, for one. What do I think the AANA and the COA can do to improve that narrative or improve our diversity within our ranks? I think it's, again, being intentional, putting programs in place or creating, for example, the COA. The COA asks program directors in their annual report how many minorities are in their programs, okay? But that doesn't necessarily mean that those students go on to be CRNAs. You never know how many finish. With that information, it sits there. There's nothing that's done with that information. So I think first we have to, again, be intentional, do something with that particular information, whether it be holding programs to account of their diversity applications, if you will. We don't track that. We don't really track our diverse applications. We track the students. So looking at how we can move students forward, and the AANA can have programs for students at meetings and things like that for diversity purposes. We're doing okay. We're not doing well. I mean, we have the Goldie Bragman lectureship, and that's one speaker where, you know, diverse people can say, okay, I'm going to go to that. We've been marking them on our programs so that you can find them, but intentionally doing programs for diverse students and combining and working with the COA in an effort to make sure that the attrition of those students are low. Because one of the calls that I get quite frequently is, I have a diverse student and I think I'm going to lose that student. Well, what's going on? What's going on with that student? And believe it or not, it's not always academics, it's the subjective things that are coming from the clinical site. So somehow we have to hold programs to account when it comes to subjective data being the reason why students don't succeed. We have to make sure the COA recognizes that, put something in place for diverse students to reach out to them without fear of retaliation. You could ask any student, probably not just diverse students, but I would say when it comes to diversity issues, they don't want to reach out to anyone, let alone their program directors or their colleagues. So we need to put something in place to give them an avenue to vent those frustrations, if you will. For current CRNAs, diverse CRNAs, we don't really have that avenue either. We only have the conversation amongst each other. So making sure that we have an avenue that is not social media, in which we can have these conversations with each other so we can find solutions to these problems, because those problems are going to continue. We talked about the diversity officer earlier, and I think that that's the individual position, if provided the resources to do that role well, that then we'll have programs that will reach our CRNAs and our SRNAs so that the AANA has a place where they can participate in this. The COA has a part that they could participate in this. And we can value both sets of folks, the students and the CRNA. Because I understand the separation, wanting to separate the two, but I really don't. I don't separate the SRNA from the CRNA, because my intent is once you become a SRNA, you will be a CRNA. So we have to, I think, be very intentional about putting programs together that connect those two groups of people so that they can mentor and help one another. And I think that that's how the AANA can be involved in that through that mentorship. And I know the Diversity, Equity, and Inclusion Committee, that's one of the things that they're working on is that mentorship database.
Thank you, Sonia. And I'm going to frame the next question a little bit differently because you actually touched on part of it. And I'm just going to ask you if there's anything else you wanted to add about development and support of a mentorship program for practicing CRNAs to pair with students and potential applicants from underrepresented population. So I'll just say that as chair of the Diversity, Equity, and Inclusion Committee, this is one of our charges from last year, and I believe it's carrying over to this year. We began work on that charge, and I feel confident in speaking for the committee in that I foresee it getting accomplished. I don't like to leave too many things on the table, and this was one of the charges, Sonia, that was left last year. It wasn't left unaddressed. It just became a logistical matter of setting up the database, and I can get a little extra sometimes. I think that's what the millennials are saying, extra. You know, I wanted to use like propensity score matching to match people together, and I probably made it a little more complicated than it needed to be. But it is one of the charges from last year. It's carrying over, and it will certainly be addressed. Along the lines of the mentorship, another part of this question reads development, or it's not necessarily a question, but a statement, development of a pipeline of activities to generate interest in the nurse anesthesia profession among nurses, nursing students, high school, and younger students. So developing a pipeline to generate interest in our profession. Would you like to make some comments on that?
Yeah, so I know several of us have gone to middle schools, high schools, and talked with students and tried to get that interest there. And we've also gone to colleges, and we've all participated, I think, at some level in the Diversity CRNA program, where I'm sure every single person on this panel has numerous amount of mentees, folks that they are mentoring that are RNs that want to be CRNAs, folks who are SRNAs, and then CRNAs. And I think that developing activities, the AANA developing those activities, and us having a base of operation, if you will, so that we can participate in those sorts of activities across the country would be very meaningful and helpful. But again, that goes along the lines of resources and how do we allocate those resources to something that could potentially be on a grand scale. So we all are doing these things individually. For example, John Bing and I can have a conversation, and we're actually mentoring the same person, we find out, but there's no real database or anything to tell us that, yes, I'm working with this individual on a particular issue, and he may be working with them on a separate issue. So I think it's important that we do have a pipeline of activities But if you think about what the Sullivan Report and the Institute of Medicine has told us, they've told us that young people start thinking about what they want to do for their careers in middle school. Now, with that being said, minority individuals may be starting to form those ideas, but they also have barriers that they have to overcome. And who's there to help them overcome those barriers? And I think that that's our role as mentors, to kind of help them overcome those barriers as much as we can. And then as they get close enough to us where we can kind of guide them through their anesthesia program, guide them through those barriers in their first jobs, if you will, I think is very important. And that would take several different types of activities to make that happen. So I think it would be very worthwhile if we could implement something to that level from the AANA.
Thank you. As we're moving through our questions, one of the questions that came immediately prior to the statement, rather, that you just asked was about diversity and inclusion scholarships. And so we are happy to report that this year we did award, and Marlene will have to correct me on this, I believe it's 3 scholarships, or Randy or President Jansky, I don't know if you remember, but I believe it's 3 scholarships that we awarded this year. So, and they will be annual. So I think that's a step in the right direction, or a step in a direction that is significant to diversity, equity, and inclusion. I'm going to remove the word right from it until the organization as a whole agrees on the direction that we're taking. From my perspective, it's a positive direction. And we may never gain consistency and consensus, from the organization as a whole, but I do believe we're headed in a positive direction. So let's frame it that way. It says development of diversity, inclusion, scholarships, so we can put a check mark next to that, grants or loans for students and faculty. So what we haven't addressed, to my knowledge, Sonia, is the development of grants or loans for students and faculty. Before you answer, one thing that I might add from an academic standpoint is there may need to also be some mentorship for applying for grants and loans available to students and to faculty for their development as well. But thank you.
Yeah, so I think it's really important that the educational piece is there for students who are looking for loans or grants or what have you for education purposes. Because again, one of the things is most of our programs are set so that they cannot go to work. And again, when we go back to what we were talking about way in the beginning about someone's experience being a lot different. If you look at the literature, a lot of the experiences of the minority student or minority applicant is much different than their counterparts in terms of the barriers that were set forth for them. And so assisting them and aiding them in getting the loans that they need, the grants that they need, I think would be helpful. I know John Bing is doing some work with that on the financial end for CRNAs, but I think helping SRNAs understand how to get through a program in the least amount of debt as possible. So I think that education needs to be there. And that would probably be helpful for all students, but I do think that our diverse students definitely need that because they're coming in with barriers or experiences that others don't have, that's putting them behind the 8 ball, if you will, because if we look at the wealth to debt ratio amongst minorities, between Caucasian and minorities, that wealth to debt ratio is very different for minorities. And so they're coming into programs, you know, at a significant disadvantage just from that aspect, if you will. If, you know, I know this is not a conversation for today, but that whole idea of generational wealth, you know, and going to school and what's available for you in that, in the money aspect of it from a generational aspect is very different for each family. And so I think having that education, how to manage that and get through that. And then even once you get through it, how do you maintain that budget so that you don't get yourself in a negative place once you do graduate? And then as for grants for faculty, I mean, I think everybody can tell you that's educator, that their paycheck looks nothing like it did when they were practicing clinically, right? And so how are they making that switch? I talked to a young African-American educator not too long ago who hasn't been doing it for that longer period of time, who's ready to go back to clinical practice because it's not economically feasible for them. And so I see that. And so what is there to help them get over that hump? And I really don't know the answer to that. I don't know what the answer is. Maybe one of the other panelists has an answer to how we help faculty navigate that economic piece in terms of getting grants. Because again, the literature is there that says that minority students do better when they are in programs or with people that look like them. I mean, and that's not just anesthesia programs, that's higher education, period. So, and it's not something that's unique to us. It's across the board in higher education that minority faculty just aren't there. And so how do we get them there? I'm just not real sure.
Thank you, Sonia. President Jansky?
I just want to say, Sonia, that's a widespread problem, I think, among all faculty. And what I've heard is that people moonlight so that they can make additional dollars to get over that, you know, kind of even that out a little bit more, because it is a sacrifice financially to be an educator. And you have to love to teach in order to be in that role. One of the things that I'm kind of hearing in the background that was in one of our questions is what happens to the minority student when they're in the program? How are we admitting them to the program? Are they prepared for the program? What's the washout rate? What are we doing to those students once they're in the program to keep them there? Because my understanding through my study, my struggle to understand this whole issue and talking to people, reading, is that there is a lot of times that the schools want the minority students. They want, and the businesses too, they want to even out the minority profile. They want to attract these students and get them into the school. Once they're there, they want to keep them. However, if they come in and maybe they don't score as high on an entrance exam because they don't have the same kind of background, they don't have the same math, they don't have the same writing skills or whatever it is, how can we measure what the gap is when we get them into the program and then they struggle because they are not, they're held to a standard that they're not ready for and they're struggling? What could we do for these students before they get into that position? Like before I went to anesthesia school, I took a statistics class. What can we do to help to figure out what it is these students are, what the gap is, and then what can we do for them before they go to anesthesia school that will prevent them from getting in that position where they feel like people are being unfair to them, people are putting them under the microscope, or they're sending them to remediation because they need more help with something, and they feel like they're being singled out in a negative way. So how can we prevent this before they get into the program by figuring out what it is that's causing them to wash out? I think a long time ago, we did figure out that ICU nurses did better than operating room nurses in the long run. They had a better graduation rate, a better pass rate on the exam at the end. So are there things that we can learn through statistics with these students as to what we can do to bolster them before they come into the program that will prevent them from getting in this situation?
Sonia, if you don't mind, let John, would you chime in for just a second on that question, please?
Jansky. And I've been with the diversity program for 10 years, and I just stepped down as the president, and we address that. And there's two things we don't want. We do not want anyone to come in that's not qualified. So let's put that on the table right away. This is not a giveaway program. This is not a quota or affirmative action. I tell students this right here is that we look at your grades, and then if you haven't taken some subjects in a 5-year period, then you need to go back and take a 600 level course to make sure that you're ready for this. And so we do not mince words with saying this is going to be a very, very tough program, and this is what you need to compete. And so I think going into the program, is no question about it, when we have maybe 150 or 200 nurses that are qualified to get in, is not about the qualification, because our qualifications are the same as any other nurse that applies to the program. What we're saying is that we want the same fairness that everyone else gets. And if you fail, failing is part of life, and some people will fail. I don't think we have enough failure rates in the ANA that there's not all minorities failing. And so obviously that when we pick students, we're looking at students with a vast array of talents and also academic achievements. And so you have 30 minutes, many times, as you guys know, to pick who do you think can qualify for this. So, I don't think it's a perfect formula that we can get, but I do think being honest with students, this is what you need to be competitive, and shadowing and mentoring, as Sonia says, at an early age. I think that's so important.
So I was just going to say, Kate, that was a lot to unpack there. But one of the things that I will say is that, yes, we definitely want qualified students, but we also want that student who is just as qualified as the non-minority student to get the same opportunity and the same respect once they are in the program. I can tell you that it has more to do with the programs themselves in terms of them being willing to say that, yes, we are biased in this area. And I can give you an example. One of the things that I noticed over the years in my own program is that we can have two very identical students or applicants on paper, and they come in and the non-minority student will get asked a question by one of the interviewers. And when they get asked that question, they answer it, and it's kind of a lightweight answer. They kind of flub their way through it, okay? And then you have that African-American or minority applicant gets asked the same question. They nail the question. They get it spot on. And then the interviewer continues to ask them more questions until they get it wrong. Then we get to the point where now it's time to select the students. And what I commonly hear sometimes is, oh, well, they got my question wrong. Yeah, they did, after you asked them so many questions, but they initially got your question right. And then there's some sort of justification why they thought that they should not have gotten it right, but they like this other student who gave the halfway answer. So I think it's also incumbent upon us as faculty members to make sure that fairness exists once we get into that interview process, that these questions don't lean towards any implicit bias that we may have. And we all have that, and we need to be honest about that. And then for those students that come in, and I get phone calls from them all the time, who for whatever reason, when we look at their transcripts and things, and we're like, okay, there's no program here that's gonna take you. What can we do to help them get to the point where they are a qualified applicant. And I think that those are the things that you were talking about. What can we do to help them become qualified applicants? And I think that that comes from that mentoring process and being really honest, right? Being brutally honest at times. I've had minority applicants who I've had to be brutally honest and say, there is probably nothing that you can do. You know, if you come with a GPA of 2.3, there's nothing that you probably can do. Like, there's no graduate level courses that you can take. But if you come in and you've demonstrated that you have the ability to do some work that all of our current students can do, I think that it's incumbent upon us to look at that and not just brush it to the side and say, absolutely not, right? So we have to make sure that we get them before they put that application in and say, look, this is how you get that application to where it needs to be so that you're as competitive as the next individual.
Sonia, thank you. I appreciate your comments. You made some salient points, and certainly we have some work to do with preparing our students, not only for recruiting them, but for retention and graduation as well. So we have just a few more minutes, and we have probably about maybe 6 or 8 more questions. So I think I'm going to choose one last question and one last respondent, if you will. And if you would limit your response to 2 or 3 sentences, and then we will move into closing our discussion and perhaps having another discussion to continue to address the questions that we didn't get to, because I think they're important. As I'm sitting here looking through them, they certainly are very important, representative, and certainly we want to acknowledge the fact that our members' topic area of kind of evening warranted their questions. So how about we end with, if you don't mind, the following question. Is there a program at the AANA for minority students to voice their concerns of mistreatment or discrimination in certain programs? And if so, does the AANA investigate said programs with unbiased review? So one person who wants to respond, and maybe if you could keep your comments to maybe 1 to 2 minutes, and then we'll move into closing remarks. There a question? Sonia?
So I guess I can answer that question really quickly. The answer is no. There's not really a pathway for students to do that comfortably for the AANA at all. There's no mechanism for that for them to do that within the AANA. But the COA does have a student can file a grievance, if you will. But I think the concern that most students have is that it cannot be anonymous. And so with that, they're fearful of the retaliation aspect of filing that grievance.
Okay, thank you. And I will say that during our last Diversity, Equity, and Inclusion Committee meeting, this was a topic area that was brought up and that we will be discussing in further detail as we move forward. President Jansky?
I was going to go like that. I just wanted to ask, don't the programs themselves have programs in place for students to report problems that they have? Isn't there something already in the anesthesia program itself for students to get help if they feel like they're being discriminated against or having issues?
So I can speak for my program. And it's the same no matter what. Even in my program, there is a vehicle for students to do that. But again, students are always very apprehensive, right? In terms of they want to get through the program. If it's a clinical site issue, they don't want to stir the pot, if you will. They want to get through the program. So they don't want to tell me, they don't want to tell anyone. But when it gets bad enough, they do come and tell. And I think that it's incumbent upon me to make sure that there is some resolution. And if it's discriminatory, then you have avenues. You know, Title IX makes sure that we have to do something about that. So, but the students are very apprehensive no matter what, because they feel like they will be retaliated against, and they have maybe another year to go in the program, and they just want to get done. They want to be a CRNA. And so they will absorb the pain and the social isolation that comes with it, and the depression just to get through the program.
Thank you, Sonia. Randy, did I see your hand?
I was scratching my head.
Okay. No. Okay.
Sorry.
Much like when I'm trying to adjust my glasses. Okay.
Exactly.
Okay. Well, anyway, well, thank you. I'd like to thank all of our panelists this evening, and I would like to thank the AANA Board of Directors, President Jansky, Randy Moore, and all of those who have submitted questions to our panel. And I would like to say, and I hope it's appropriate to say this, that while we didn't get through or get to addressing all of your questions, it is at least my hope that we can continue this conversation and continue this discussion and to continue our work toward diversity, equity, and inclusion, and possibly having another town hall where we can continue to address the questions that we weren't able to answer or to have a discussion about. So again, I am Monica Rose, and I am the chair of the Diversity, Equity, and Inclusion Committee. Thank you for your time. And I will now turn this over to President Jansky for additional closing remarks.
Thank you, Monica. Thank you all the panelists and everyone who's watching this. I'd like to thank you for joining us for this town hall discussion. This will be the first of many as we move on to strive to understand each other and offer an equitable voice for our members and students. I hope the questions today maybe have prompted some other questions on the part of the people who are watching so they can send more in. Please send all your questions regarding this town hall to diversity@aana.com. Again, thank you for joining us, and looking forward to seeing you all again soon. Bye-bye.